Well, good evening, everyone, and welcome to tonight's webinar on eReferrals and Medical Director. We thank you for taking some time out of your evening to join us tonight. My name is Angela Heathcote, and I am from Eastern Melbourne Primary Health Network. Together with my colleague, Kirsty McDougall, we welcome our guest speakers, Eric Dunn and Carmel Servin from SR Specialists and Referrals. In this session, our guest speakers will demonstrate using Medical Director, how to easily refer to private specialists using electronic and manual processes through one simple process with HealthLink SmartForms. I would like to start by acknowledging the traditional custodians, the Wurundjeri people of the Kulin Nation, whose unceded lands I am working on today. In the spirit of reconciliation, Eastern Melbourne PHN acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. Eastern Melbourne PHN is primarily funded by the Australian Government to improve the care and support people receive from health services. We aim to improve the health of our community, which includes using technology to make the broader health system work more efficiently. Before we begin tonight, just to let you know that all attendees will remain on mute. You can ask questions at any time by typing them in the chat box or the Q&A. And for those questions not covered in the presentation, our guest speakers will be more than happy to answer these at the end of the presentation. Tonight's webinar is being recorded and all attendees will receive an email with a copy of this recording, the presentations and any relevant resources. At the end of tonight's webinar, you'll receive a short survey. We'll be grateful if you could please take a few minutes of your time to answer these questions. So without further ado, I would like to hand over now to our first speaker, Eric Dunn, to begin. Thank you, Eric.
Thank you, Angela. Hi, everyone. My name is Eric Dunn and I'm the presenter for this evening. I begin by acknowledging the traditional custodians of the land on which we meet and pay my respects to their elders past and present. I extend that respect to Aboriginal and Torres Strait Islander peoples who may be on the call this evening. A quick bit about me first. I've been in information technology for over 20 years, the last 9 in digital health, and most recently 4 years as the digital health manager at the Sydney North Health Network. I now help specialists and GPs with the eReferrals at SR. Tonight, I have Dr. Carmel Servin from SR Specialists and Referrals to help with the demonstration and answer questions. Welcome, Carmel. Tonight, we're going to talk about the existing referral process, how we've collaborated with other businesses to make the eReferral process easy, why you should use SR Referral, why you're probably already live with SR Referral and how easy it is to get set up if you're not. Then I will do a quick demonstration on SR Referrals in Medical Director and a quick look at what the specialists see when they receive an eReferral in Genie. Then a section on how we can help and an opportunity to get your questions answered. With questions, please use the Q&A button at the bottom of your screen. You can open it now and type questions as we go through the webinar. Please don't be shy with the questions. Feel free to type your questions as we go along, as there will be a thorough discussion at the end of the demonstration. The handouts and recordings will be sent to everyone after the event. By the existing referral process, I'm talking about letters, faxes, and emails. With faxes, how do you know if the whole fax went through with all the attachments? With email, how do you know if the attachments got stripped out or if it went into the spam folder? Did it even go to the right person? Referrals that go to a practice where a specialist no longer works will mean spending extra time following up and sending it to the correct practice or contacting and finding another specialist for the patient. Where do you find the specialist? And how do the specialists find the referrals? Is it easier to just ask the GP to refax it when the patient turns up? There's a huge amount of time spent scanning paper documents, both at GP practices and specialist practices, attaching scanned documentation to patient information in the clinical system, following up that the referral has been received, and retyping patient information. I've had clinicians express to me their frustrations with the time spent on administration, not to mention the frustrations of the administration staff. GPs and specialists have had secure messaging systems for years. So why no eReferrals? Well, possibly because there are multiple directories. Each hospital has its own directory. There are paper directories and online directories. There are multiple secure messaging providers. How do you know which one is being used by the receiving specialist? Specialists move around between hospitals and practices. GPs have multiple templates for different systems, for different specialists, out-of-date templates that need changing or just don't work. And you have to know all this before you even start an eReferral. So the system is unworkable. It's easier to just send it by fax and deal with the fallout from that. So what have we done about it? Quite frankly, it takes some outside the box thinking and not trying to reinvent the wheel or corner the market, but build on the existing systems that work. Supermedia have collaborated with HealthLink to provide an end-to-end solution for eReferrals called SR Specialists and Referrals. SR Specialists and Referrals is the online version of the printed directories integrated into your practice software and linked to HealthLink SmartForms to securely and seamlessly allow eReferrals. So here's Carmel to talk about Supermedia and the collaboration with HealthLink.
Thank you, Eric. Thanks, Eric. So Supermedia, it's a family business, and it was actually started by my parents just over 30 years ago. And we've been doing the directories for many years now, over 20 years in Australia. And obviously going to print inflicts a certain amount of rigour in our updating process that we're fairly well practiced at. And we're delighted now to bring you live updates on a daily basis on the online version. So we're still publishing the print. Obviously not everyone has access to the online resource, but if you're on Medical Director, you do. And you have the advantage now of seeing the up-to-date information come through daily through the year. We do the matching of the HealthLink EDIs, the delivery locations that the specialists have, against their locations in our directory. So what that means is you no longer need to update your local address book because all that information is contained in the SR service as part of the service that we provide. And we've had quite a lot of experience at supporting electronics. So we've been live in New Zealand since 2015 with the SR service as well. And that's going very well. And we're very hands-on in our support to both GPs and specialist practices to train and to help you build trust really in a new process. And we're excited to be doing that in Australia now. And so we're integrated, SR is integrated in Genie, Medical Director and Best Practice, as well as others. HealthLink. So we're delighted to work with HealthLink. We've actually had a long-standing relationship with HealthLink as well. They're a company of a similar length to our own. And obviously they've got a strong footprint in Australia in terms of their integration across many of the software providers. And you're probably already familiar with the SmartForms that are now rolling out through Australia. So you will have seen the Fitness to Drive, My Aged Care and various hospital forms. The SR form is very similar to these other SmartForms. So it's the same type of workflow and you find the form in the same place. So we're really building on what you're already familiar with and just making the process easier. So SmartForms is an everyday tool, which I hope you're using now. And you may already have spotted SR, and if not, you'll soon know all about it. I'll hand back to Eric.
Thank you, Carmel. So why SR referrals? We have streamlined the referral process end to end. With faxes, the GP doesn't always send the fax. Typically, it goes to the admin staff to manage. With SR, the GP sends the referral directly from their clinical software. The referral contains all the pertinent information on the patient that can be directly imported into the specialist software. We'll show you this in a minute. You only need to look up one directory for all specialists because it's always up to date and clearly identifies the referral pathways. There is one template for all referrals, both electronic and manually by fax or letter. It meets the requirements for GP accreditation and EPIP, and you can provide the patient with information about the specialist on the spot in a format that suits the patient. I'll show you this as well. For specialists, there is less printing, scanning, and data entry. The eReferral is received straight away, it's easier to find, and there is more information about the patient, which can be automatically imported into their software. I'll show you how this happens. It's very easy for specialists to update their information in the directory. So as the specialists transition from manual to eReferrals, you will see the updated information in your software immediately. If you have HealthLink and Medical Director or Best Practice, you are live for SR and there is nothing to do but use it. I'm about to show you how, and if you need additional support and training, our contact details will be at the end of the webinar. If you have HealthLink and other software, and your software is compatible with HealthLink SmartForms, then you can receive eReferrals and send via secure messaging. In this case, you can still contact us for support and training. If you don't have HealthLink, register for a free HealthLink EDI address. If you are on compatible software, then HealthLink will remote in to set up your messaging. If you are not on compatible software, then you can be set up with a portal account. So let's see how easy it is to use SR. I'm going to demonstrate how to find the SR Smart Form in Medical Director, how to navigate the directory and find the specialist you want, how to create and send the referral or park it while you wait for results, and what the referrals look like when they arrive with the specialist, linking the referral to an existing patient, or creating a new patient from the referral. So let's get into it. I'm just going to change to my demo screen. Okay, hopefully you can see that. So here we have Medical Director. Can I just get acknowledgement?
Yes, we can see that.
Thank you. So first I'm just going to open a patient file. So obviously we have test patients in here. The one we have is Mr. Donald Duck, who is 71. And obviously I had that open earlier today. So in here we can see in the correspondence out that we've been using this to send quite a few referrals to specialists, mainly to our test specialists, and they all appear in the correspondence and also in the letters. But what we're going to do is to go into HealthLink, and you can see that they're all in there as well. So from the HealthLink tab, I'm going to go to a new form. And when the HealthLink SmartForms form comes up, we can see at the bottom here, there are a whole lot of referred services that you're probably quite familiar with. This particular form has all of the ones that are available across Australia. For instance, the Northern Sydney Local Health District, Northern New South Wales, Eastern Health, and so on. But what we're interested in this demonstration is the SR Specialists and Referrals for private specialists. So we click on that. And here at the top of the form, we get the search field. And then as we scroll down, we can see there are recently profiled specialists. So we're having new specialists improve their profiles all the time. There's a little video that's only a minute and a half that shows you how to use SR. And at the bottom are your support options. Excuse me a minute. Okay, so for the moment, let's go back to the search. So if you know the specialist you want, then what you can do is you can just type their name straight in. I'm going to go for Robert Whitbourne. So Robert Whitbourne, and he's a cardiologist. and we'll go search specialists, and that'll bring up Robert's profile. And as we can see here, it brings up his credentials, his about, well, it's all about Professor and where he is, what services he provides, and where he practices. So we can see that it's at Werribee and East Melbourne. If this is a specialist that I use a lot, then what I can do is add him to my frequently used list, and I just click on that button there, and there is a frequently used list in lists. So if I click on that, here you can see that there's a whole lot of frequently ones, but at the bottom is Dr. Whitbourne. So I'll just go back. The other thing that I can do here is that I can, if I say, oh, okay, I want to email this information to the patient. So if I click on email patient, I can put the patient's email address in. So I'm going to put mine in. If I can spell. And send the email. Now, this email is not being sent by you. It's being sent by SR specialists and referrals. So you're not exposing any of your contact details to the patient. You can also see here that your patient can access the profile on Oz Health Pages. So Oz Health Pages is an online version of the directory that's in your software. So I'll just switch across to Oz Health Pages, which is this one. And we can see here, this is ozhealthpages.com.au, and we can do you can do the same searching in here for specialists as you can within your software. But also that should have turned up in my email. And there it is. So specialist and referral surface information on Professor Robert Whitbourne from your doctor. So if I open that email, this is what the patient sees. And there's a click here to view the profile on Oz Health Pages. So I click on that and it brings up his profile in exactly the same way. And this way the patient has all the information on the specialist. Also, if the patient looks at this on their mobile phone and they can click on the phone link, and they'll be able to phone directly from this web page to make an appointment with that specialist. Okay, so going back, let's do another search. So I'll go back to the main search. And this time I don't know who I'm looking for exactly, but I want general surgery related, for instance. So we'll have a look at a category, general surgery related. And I click on that link and I end up with 338 results. So if I'm in, for instance, Box Hill, in Victoria, I can click on that and search, and now I get 20 results. And you can see that some of them have profiles and some of them don't. And some of them are manual refer and some of them are eRefer. Let's go and have a look at this Melbourne Gastro for a minute, because this one doesn't have an eReferral button on the top right. And the reason for that is that there are multiple specialists at this group. And you can see that they are at multiple locations. And these are the specialists that work there. And if we have a look at this section here in the middle, we can see that these are live links. And so I can pick which specialist I would like to send the referral to. And we can see also send them emails, go to their websites, and we can see on the map where they're located. So let's just go back a bit, back to general surgery related. And let's say we're looking for endocrine surgery. And the specialist that we would like to see to send a referral to is Mr. Stephen Farrell. And Mr. Farrell is a manual refer only, and he's practicing at 2 places. So I can click on his link and see the information about him. Same thing applies. I can add him to frequently used. I can email the patient. I can print a patient handout. And if I happen to know that he's moved somewhere else, I can report an update on his profile. But for the moment, let's do a manual refer for Fitzroy. Now I can do a manual refer because it's not being sent anywhere. I have to go through another process to send it. So this is a standard referral form. And you'll notice that it says at the top, only eReferrals support attachments. This recipient is unable to receive referrals electronically, and manual referrals do not support attachments. So we can't attach anything to this referral. But what we can do is it brings through a lot of information from the software. So at the top here, this has got an exclamation against it, and so has this one. So these need to be filled out. And when we look in here, the main body will see that there are items with red asterisks on them, and they're the ones that need to be completed. At the moment, the only one that's not completed, because it's pulled everything through from both eReferral and the software, is the reason for the patient referral. So I need to put that in, or I can browse the consultation notes and bring through some consultation notes. And I might pick one and bring that through. So that was a test referral that we did earlier. It's gone into the patient notes, so I'm going to attach that. And then I can work through the rest of them. So there's no point attaching anything at this point. And I can also bring through any medications, or if the medications are irrelevant to this referral, I can remove them from the referral. I can then tick or untick allergies and alerts as appropriate. I can also make additional comments. I can bring through the medical, social, and family history and tick or untick them as required. I definitely need that one. And working through this, I can see that all the information has been brought through from the patient file and the referrer information with my phone number and email address. So from here, what I can do is I can preview it, and it'll bring it up as a PDF file. And not that one, that one. There it is. And I can close that, print it. And when I print it, it prints to PDF or whatever your system has been set up to print to, probably PDF. And then I can open it, and I can do what I normally would do with that as a manual. So I can fax it along with attachments, or I can email it and so on. All right, I'll close that one. And then I'll create another one so we can see an eReferral. So I'm going to start a new form. Now, because this system is live, I'm not going to do an eReferral to a real specialist. We have a test specialist in here called Dr. Ia Loeb. And because I know the name, I can search for it, and there he is. I'll click on his profile, and I'm going to do an eReferral. Now, this eReferral will go to an address, to the address of a HealthLink portal. So I'll be able to show you the eReferral when it's done. Because it's an eReferral, I still need a reason. And once again, I can still bring through the consultation notes, but for these purposes, I'm not going to attach any of those. I can attach reports. So at the moment, there are all sorts of reports in here that are previous referrals. So as you can see, I can attach a previous referral if it's appropriate to do that. But what I want to do is browse for a local file and attach an X-ray. And then it will show me at the bottom of the screen that there is an attachment. Same thing with all of the medications, allergies, alerts, social family history, hypertension, etc. The patient information is all complete. And then the referrer information is also complete. So now I can preview that, or I can park it. Now, why would I park it? I can park it so that if I happen to be waiting on some results to come in before I send it, then I can park it and come back to it later. But for the moment, I'm going to submit it. And that has now been sent. And it says at the top here, referral sent and acknowledged, and it gives me a date and time. By acknowledged, it means that it has been received by HealthLink. It doesn't necessarily mean that it's been received by the specialist at the other end, although they'll get it very soon. So I'll close that. And in my list of HealthLink forms, if you have a look further down here, I have a couple that have been parked. So there's one here that it's got a message ID with a PO on the end, and PO means that it's a manual referral. Same thing applies. I've parked it, I can open it and then continue processing that referral. Or there's one further down here, which has also been parked. But if you've got a lot of referrals in here, as we have, you can see, and you just want to look and see which ones are parked, just in case I've missed any, you can filter. So I'm going to filter that on parked, go OK, and we can see this one. So I can open that one by double clicking it. It brings it back up. Now, the only thing about a parked referral is that I need to reattach the reports or anything that I had attached to it before. So you can see there's nothing down the bottom. So I can reattach that. Browse for a logo. This is a different referral, by the way, but I can still open that and it's going to another test. And I'm still going, oh, actually, I need more information. I'm going to park it again. Please note attachments selected from PC need to be reattached when resuming the parked form. Okay. So let's go and see if that other one has turned up, which should be in my HealthLink portal, which is not there. It's here. Just bring that across. So this is the HealthLink portal. And in here, I'm going to log in with my username. And at the top here, we've got a test referral to earlobe for patient Donald Duck, and it was sent at 19:27 Sydney time. And I can open that and see the referral as the specialist would. And you can see it's 2 pages with all the information in it and the X-ray. The portal also has, as well as being able to receive access to the same SmartForms. As you can see, it looks exactly the same, and I can also go in here and search and create a referral in the portal. The only thing that the portal doesn't do is pull any information from the clinical software. Okay. So the next part is to see what happens when that referral gets to the specialist. So if I'll just hand across to Carmel, and she'll show us what happens to the referral when it gets to Jeannie. Are you there?
Yes, thank you, Eric. I can share my screen.
You should be able to share.
Just maybe do a stop on yours.
There we go.
Here we go. So, thanks. Where's my Jeannie gone? Opening up Jeannie. Eek, 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 eek. It's hiding from me. Hang on. Right, there we go. Sorry. So I'm on Jeannie here. I've actually remoted to another machine that we have Jeannie on just for this purpose. And where I've gone to, I've actually gone straight into incoming letters. So this is where specialists see the letters and the information coming into them from the specialist clinics and also from lab results and other places as well. And the first thing they would normally do is click to all so that they pick up any correspondence regardless of which GP specialist name it's been sent under. And then here I'm currently seeing the unlinked list. So they have the option of seeing a linked list, and that's other letters that have already come in and being linked to a patient record. But in the day-to-day, the first priority is actually going to be the unlinked set because they will be the new letters coming through. So I've got a little list here, and I'm just going to click through and show you how easy it is. So I'm opening up the first one, and here is an earlier referral that's been sent through. And as you can see, we've got our attachments. And one thing you'll probably spot as you go to do them is on your version of the report, it will show the list of the file attachments, but you won't actually see at the moment the actual images or the documents themselves on the version that saves into your software. The file name is referenced, but it isn't showing on the version of Medical Director. That is a change which HealthLink are working on at the moment. So hopefully soon you will see the actual attachment documents themselves in your referral PDF. But really what I'm showing you here is that you can see they definitely do come through at the specialist end. And it's just a saving issue at the Medical Director end that they're not including them on your view at this stage. But they are all here, which is good news. So, and you can see here up here, it's looking for a match. So basically, when there is all green ones, I'll click through and show you a green one. I've got lots of Donald Duck referrals. I'm just clicking past that. So here's Kate Blanchett. Now here what's happened is the software has found a matching record. There's already this patient. This patient has already been to this practice, and here's another referral for her. So all that they need to do is to go link. And that has now assigned that referral to that patient record. It's linked it. And here's another one. And again, I can just go link. So if that's already there, it's dropped it onto the patient record. Now, this one, it hasn't found a match for. So this patient name is Amanda Greenslade. And the little red lines mean that it's not finding a match. So what we can do here is go new. And what this does is it takes the information that's contained within the referral PDF and uses it to automatically populate the patient record in Jeannie. So it's actually saving the staff the time of having to manually type or copy and paste that information in. And it's obviously going to help with reducing errors in that. And so it just really simplifies that process for them. So they can go save that new patient record, and then it's all linked, showing ready to link, and do the link step. And here's another one that's a new one. So I'll just do that step again so you can see. So David Anderson this time. So again, I'll go new. And again, I can go save. And now I can link it. And if I go back now, I'll just close out of here to the list again. I'm just going to go, I'm bringing up the link, and you can see here some of the ones that we've just linked, David Anderson and Amanda Greenslade. And if I go into, just click on here, that's brought that piece up. And I can also go over to open the patient record and see it there as well. So under patients, if I do a search, I can obviously search for oops, I've done a new one. I'll just do a search is the one over there. We go. So I can search here for, I'll put in green, and that's going to bring up her record. And you'll see here's the referral. And then also, if I click across back on the incoming letters, the other thing which is very helpful is that if they haven't yet linked that referral, they can do a search here as well. So quite often they may not want to create the patient record in the specialist database until they hear from that patient, or until they phone the patient and confirm that they're coming. So they're able to search on the patient's name in this incoming letters list as well. So the whole point of this is so that they don't have to say to the patient, please refax. And so this is where we're providing an additional training, and we're making sure that the staff are aware that they can go to incoming letters. A lot of them do know about this, and some are learning quickly. So it's a learning exercise at both ends that we're supporting. As much as helping GPs with knowing how to send referrals, we're also helping specialists with knowing where to find the referrals in their software. I could hand back to you, Eric. I covered everything there.
That's fantastic. Thank you.
Yep.
I'll just share my screen.
There we go.
I think I've got the right one up. So thank you, Carmel. Well, we provide extensive free training for your staff and are happy to contact the specialists you refer to so they can use SR as well. Whatever their workflow, we can help them integrate SR so you can both reap the benefits of electronic referrals that work. Our sole purpose is to help GPs and specialists, and we've been doing it for 30 years. We're sensitive to your requirements and admin processes, and our tools will make your life easier. Feel free to call or email us with queries or for training. Let us know if you have particular specialist practices that you would like to see shift from faxes to eReferrals. Let us know and we can contact them and offer setup, support and training. Because the system is live, it updates instantly. So if a specialist joins or leaves a clinic, if they change their contact details, if they add or remove consult locations, or even if they're just doing telehealth consults, as soon as we know, you know. And finally, we help specialists by providing basic entries in the directory for free. Specialists can improve the visibility of their entries by including information on their services, their photo, and be listed under multiple categories. Paid entries are annual, and a package entry in the medical and their entries are in the medical specialist directory, SR and Oz Health pages, which I showed you before. There is no charge for GPs to use this service. So thank you very much. I'll hand back to Angela and see if there's any questions.
Great. Thanks, Eric and Carmel. We have received one question, which was going to fit with my question that I had for you as well. The question is, are all specialists listed? Or if a GP actually notes that there is a specialist missing from the directory, what's the go there?
So we are adding specialists all the time. They're all able to be listed. So this is all private specialists that we include. Specialists that do public only, we don't include those because you can't refer directly to them. But even if they're just part-time private, they can be included. And if you spot one that isn't in that you'd like added, by all means, contact us. So you can send us an email. The email address is on the bottom of the SR page. And we will get onto that straight away because we really like adding new specialists to the directory. So we reach out to them and basically offer for them to have an entry. They can list for free. So all specialists are able to be included and to receive referrals at no cost. And it's up to them whether they wish to include more information and take a paid entry.
Thanks, Carmel. We don't have any other questions. Is there any other questions that are coming through? We'll give it a few moments. but if not, no, there's nothing coming through. So Carmel and Eric, as always, thank you so much for the presentation tonight. It has been very informative and very helpful for all of us. So as mentioned, you'll all receive, no, there is one. There's, can I choose a specialist in your patient's home?
Yes. So you would have seen in the demo, Eric, you might be able to share your screen again and just bring it back up so we can show people. You can refine your search by location. At the moment, that is, it's just on the suburb name and the postcode. We are actually about to do a refresh of how that search works, and it'll work a little bit more like a Google search where you can type in a location and have a radius and area around that as well. But yes, you can definitely find specialists across lots of locations. And there's a couple of ways you can type that in. You can narrow down to a specific suburb, or if you just type in, say this time, Eric, maybe go into a different category, yeah. And then if we type in just Melbourne, so rather than choosing from the drop-down list, we'll just keep it really broad and just go search. That should bring up a broader set. Let's see what happens.
It's not bringing up.
No, just go search. Yeah, just go search on that. So it just depends how you enter the address information. So there's an enter suburb or postcode, that's a refine there. And you'll be able to continue doing that refine, but it'll be, instead of being nearby suburbs, we found that we could improve that by doing a location that's geographical radius, so just extending the area from where you start. So that's part of the functionality that we're tweaking. We continue to make improvements as we get feedback from GPs and specialists, so we really welcome any requests that you have or any other ideas that you have. By all means, reach out to us with those as well. We're having lots of conversations with both GPs and specialists at the moment to make improvements to the service, and yeah, so we're keen to do that. Being new, I'm sure there'll be other things that we can do as well.
The other thing that I didn't mention before was that the support and training that we provide to both GPs and specialists is included. It's free. So we're not trying to, we want the system to work and we want it to work for you. So we're offering the training for free.
Yeah.
And I also didn't mention that if you are looking for someone who has urgent available, you can search for that as well.
So there's refine bys on the searches. What else? I just saw that I can see the questions popping through too.
Yeah. So the question is, do the specialists advertise their fee structure?
It's up to them whether they do that. So they can include that information when they include a profile with us. So a profile enables them to list more about their experience and the services they offer, their credentials and their fee structures. So some specialists do choose to include that because obviously it is helpful, but it is up to the specialist what information they include around that.
Yeah, fantastic. And does it display telehealth options as well, information?
Yes. So some specialists actually list as one of their locations telehealth, so that's an option. And then we also have the refine by for telehealth as well. So it's possible to go in and see specialists that are doing telehealth on the refine by also. Maybe under the paediatric set. I know that some categories are more into telehealth than others we're finding at the moment. In particular, paediatrics and psychiatry are quite popular for telehealth, but we've definitely seen an uptake in telehealth. Obviously with COVID and people are doing that more. I think we're just doing a glitch on that. But yes, there is telehealth available, and we're adding to that all the time as well.
Fantastic. Thanks, Carmel. Well, I think that is the end of the questions for tonight. So, Carmel and Eric, thank you for your presentation this evening. As mentioned, everybody will receive a copy of this presentation as well as the recording and resources via email. If you do have any specific questions for Eric and Carmel or would request some extra training, at the end of tonight's presentation, a survey will pop up. So we will greatly appreciate if you do take a few moments just to complete that for us. So thank you, everybody, and have a great evening and good night.
Thank you.
Thank you. Good
Thank
night.
you.